Good morning and welcome to this edition of SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Really excited today to bring on Dr. Stephen Reichbach. How are you this morning, Stephen?
I'm doing well, thanks. How about yourself?
Good. I have a very bad habit of butchering last names, so I want to make sure that I get it right. So you're with the Reichbach Center and you do a number of things with ketamine and medical marijuana. So tell me a little bit about yourself, how you got into the industry, and then go into a little bit of detail about the center itself.
Sure. So first of all, I'm an anesthesiologist by trade. Moved down to Florida about 7 years ago, and was practicing in a large anesthesia group in New York. The plan was to stay away from large anesthesia groups, moving down here and maybe focus on working in surgery centers, smaller type practices, and that kind of thing. And during my first year down here in Florida, started becoming really interested in using ketamine, which I've used in the operating rooms and burn units and different clinical situations for many, many years. Became acquainted with how it had been started. It started to be used as a off-label treatment for refractory depression, treatment-resistant depression, anxiety disorders, PTSD, and certain neuropathic pain syndromes. I became pretty fascinated and almost obsessed with the direction that was going, and I thought it would be interesting to kind of pursue maybe looking into how I could set something like that up here in Florida, offering patients treatments where nothing really else had helped. The patients that we started reaching out, looking to get the word out to, were patients who had pretty significant mental health issues, pretty significant chronic pain issues, where they'd typically been on medications for many years. This wasn't something that was just popped up really out of nowhere, more situational. This was something that these type of patients had been through many different types of modalities of therapy, medication, therapy. Many of them have been through transmagnetic cranial stimulation treatment for depression, and many even electroconvulsive therapy, and have not had any persistent or sustained benefits from any of those.
Let me ask you, a lot of folks out there probably don't know. I mean, we all know what marijuana is, but a lot of folks don't actually know what ketamine is. So I just want to make sure that we talk about the differences, because it's also holistic. So it's something that, isn't just a prescription or a pill. So talk to me a little bit about that.
Absolutely. So ketamine itself has been around for probably about 65 years. It was invented, it's a synthetic drug that was invented to sort of replicate another drug, phencyclidine, or better known as PCP. And the reason, what they were trying to look for was a medication, an anesthetic, that closely resembled the dissociative properties of PCP, but not so much of the dissociative aspects of it. And so they came up with ketamine, which is now on the World Health Organization list of 5 of the required medications that are most beneficial around the world. And so it had been used, it's been used in operating rooms and burn units, and as I said, surgery centers, and it's a fantastic analgesic. It's a fantastic painkiller, number one. It's also a great anesthetic. The properties that kind of make it unique from other anesthetics when we're using it in that realm are that it causes minimal respiratory depression, which is a very important aspect of it that kind of distinguishes it, and really very minimal hemodynamic, or what I mean is changes in blood pressure and heart rate. So those aspects and unique aspects of it make it a very attractive medication as an anesthetic in certain situations. Over the last 15 to 20 years, however, it's been found to have very profound antidepressant effects.
That's good to know.
It was found out sort of incidentally or by accident in evaluating postoperative patients who had histories of major depression and had gone through surgical procedures. And post-oping these patients, the next day, 2 days later, were found to have lifting of their depression, decrease in their anxiety levels, and the commonality was that they had received ketamine as part of their anesthetic for the surgery that had really nothing to do with it. That sort of spurred some studies that were initiated on taking low doses, relatively low doses or sub-anesthetic doses of ketamine, and treating patients that fit certain criteria for depression. How long had it been going on? How significant was it? What were they treated? How was it treated previously? And what they found was really nothing short of, astonishing, because virtually all of the patients had improvement in their depressive symptoms. And so what they did notice was that it was relatively short-lived. So most of the patients that had received an intravenous low-dose ketamine infusion had some lifting of their depression and improvement in their symptoms, but it only lasted about 5 to 10 days. So they continued with the research, they continued with the studies, and they said, well, if one infusion helped, these patients for 5 to 10 days, let's try to do 2 infusions. And so that's kind of how the whole thing got started. And so what we do is we do intravenous ketamine infusions. You'll hear about ketamine nasal spray and ketamine lozenges. Really, the gold standard to find out if ketamine is going to be beneficial is really through these IV infusions, because 100% of the medication is getting where it's supposed to go. It's easy to titrate based on a patient's response, because the patient doesn't respond at, let's say, 50 milligrams, you go to 60 milligrams. So we know that the 60 milligrams is going where it has to go. If you're using another route of administration, if you're using a nasal spray, and let's say you're planning to use 40 milligrams of a nasal spray, you and I can both use that nasal spray, and of that 40 milligrams, you may absorb 70% of it. I may absorb 50% of it. Let's say you have a cold or you have nasal polyps. There's a lot of variability with the absorption. And so it's difficult to titrate, even from patient to patient, or even a patient who, from one day to the next, there may be some variability. So if a patient doesn't respond, it's very difficult to say what dose they're actually responding at, because you don't even know for sure what their levels of ketamine are, following it. So we focus on the IV ketamine infusions. We typically will do, for patients that are good candidates, we will do 6 initial infusions. We try to do them within a 2 to 3 week time frame. We've tried to stratify which patients or who's a good candidate, who's not. What we're seeing is that very little to predict who is going to respond and who's not. We do know that older patients over 65, there's generally about a 50 to 55% positive response rate or success rate. Patients under 65, however, we're seeing about 80 to 85% with a positive response rate. So
that's amazing.
It is amazing. It's been nothing short of, for us, eye-opening at the very least, and probably the most rewarding thing that I've done in my entire career. Because
yeah, it's always great to be able to go in a holistic manner rather than just, trying to throw a medication at it. So do you combine the 2 therapies with, medical marijuana and ketamine, or how does that work?
They're really 2 separate aspects of what we're doing. We kind of, the way the practice was set up was really to offer alternative treatments to patients who are struggling with really intractable conditions that nothing else has helped. And so doing the cannabis assessments was sort of seemed to be a logical add-on to the practice. We did it probably 2 to 3 years after we began as the Ketamine Center. And we do have a lot of crossover of patients. Obviously, a lot of our ketamine patients do end up with a medical cannabis card, and it's appropriate for a large number of them, and it's not appropriate for another segment of those patients, and vice versa. Patients who will come, and be evaluated for a medical cannabis card, very oftentimes they happen to be good candidates for the ketamine therapy. And,
Yeah, it's great that you can, juggle between the two holistic options that are out there to determine what's best for your patients. I think that's amazing. Well, I want to thank you so much for coming on. This is definitely one of those topics that I think we could talk about for probably another 45 minutes. But we should definitely have you on again to kind of elaborate on some questions that our viewers have. So any questions that you have, our viewers and readership out there, if you could please put them in the chat. We're going to have Dr. Reichbach on again soon to talk about any of those concerns and maybe even kind of elaborate a little more on what ketamine is.
Sounds good. Thanks for having me.